So we have remarkable growth. We've seen remarkable growth in our services. We have been able to see steady growth in a number of our clinics, so which has been positive because it tells us at least the community has received our services well so far, and we are grateful. So for this medical facility, we have general accident and emergency services. We have outpatient services, general outpatient services. We have pharmacy, lab services. We have well baby services, or what we call the vaccination services. We have the international travel vaccines for those who are traveling and need travel vaccination. We have nutrition support services for nutrition clinic, and growth and monitoring services that offers also growth and monitoring services. Yes. So for the area where we're at Utawala, we have seen a great need for pediatric specialties. So what we've looked at, we started with a number of pediatric specialties, and we are seeing more demand for those pediatric specialties. So we'll continue to expand the scope just to ensure we meet the needs of the community around us. We also have seen a demand for pediatric dentistry with a lot of, because of the water source in Utawala being majorly borehole, we have a lot of what we call fluorosis. So we plan to ensure that we support the pediatric dentists in terms of diagnosing and also doing a lot of health talks within the community, just to ensure we are able to support the community with that. So for me, it's just to welcome the community to Gertrude Children's Hospital, Utawala Medical Center. The clinic is accessible. We have engaging and experienced staff in terms of pediatric speciality, and the environment is child-friendly. So we are here to be able to meet the needs of our customers, and to offer quality customer experience. So we look forward to seeing you all. So we do a number of community engagements. We work with schools, we work with churches around us, we work with estates, we work with the corporate banks, the corporate companies within our community, just to ensure we reach out, especially once we do the health demography and we realize there's a health prevalence of a certain disease, then we are able to engage the relevant partners to ensure we are doing health education to them, just to ensure we are able to minimize the morbidity of the disease, and also just to ensure we are giving the right education to all our partners, to the community, to the children community, so that they're able to take care better of their health, and also just to promote the health and their well-being.
Today, the 16th day of June 2026, we are at our new branch of Gertrude Children's Hospital, Utawala branch. This is our 18th clinic, what we call a hub and spoke. So we run a fully integrated service of primary health care, secondary health care, and tertiary care, and a bit of quaternary care. So our outpatient facilities, including this one in Utawala, is one of our primary healthcare centers that through which we provide primary outpatient dental, preventive vaccination, and other outpatient pediatric services to our clients. The biggest issue in healthcare nowadays is growth of outpatient services. So all healthcare in the world is really moving to outpatient services for many reasons. One is to increase access. Everybody needs to get access to a healthcare facility within 5 kilometers where they live. So in that spirit, we try to provide services closer to our clients as much as possible. Number two, healthcare is really outpatient. 97% of healthcare is outpatient. So our approach is to provide as much outpatient care as possible, so that we provide early interventions. Our clients are able to access quickly, and we provide the full area of outpatient care, which then makes sure that patients don't need to fall sick enough to require inpatient care. We're glad to be in Utawala, and we want to thank all the partners that we work with in Utawala, primarily schools and business community, and the community at large, the neighborhoods, the estate associations within Utawala, and we want to thank them for welcoming us to Utawala, and we can only promise that we provide excellent pediatric care to their children.
Children's health is fundamental for educational outcomes, in that a healthy child is a child who can concentrate. A healthy child will complete their assignments. A healthy child will give the teacher ample time to complete the classroom teaching and assignments thereof. So health in education is actually paramount to educational outcomes. In fact, it's a welcome hospital to this particular area and the community, especially the schools in this area, because it's within the schools that we have a lot of children. So the support that the hospital will be able to give, especially in handling emergencies, considering our roads, which are normally very congested sometimes. So the community will really have an advantage because of the proximity, number one, and also the quality of health that Gertrude is offering. Very good. Schools and the hospital can collaborate because, education is a tripartite. You need the parent, you need the child, and also you need the health facility. Because as we earlier said, health in education is key. So the hospital can partner with schools to give the teachers talks on health education, to train the teachers also on first aid, and also collaborate with the parents during the parents' days and open days for the school so that we can be able to educate the parent who is the primary caregiver of the child. Families around Utawala take advantage of proximity, take advantage of the good facility that is here, even the dental care of the children and also the pediatric care of the children, which is very close to the homes. So there is no need to beat traffic to get to hospitals that are very far. So the community has an advantage.